As David said, my name is Kathy Percy, and I am a stage 3C malignant melanoma with recurrent in-transit metastasis patient at Levine Cancer Institute. Let me go ahead and get this out of the way. First, I'm not a public speaker. I'm terrified about what I'm about to do, and that's to tell you my melanoma story. A few months ago, when Paige reached out to me, she works with Adrian Foundation, and asked me if I would consider speaking tonight as a patient. I'm pretty sure my heart skipped several beats. But it didn't take me long to realize that this was something that too important for me to say no to. So I humbly ask you to be patient with me as I tell you my story. The topic is too important. Melanoma is an extremely aggressive cancer that is taken far too lightly by far too many. A common theme is it's just skin cancer, you can cut it off. In 2023, it's much too naive to view skin cancer in this matter. Ignorance is not bliss when it comes to skin cancer. I still, after 2.5 years of being diagnosed with malignant melanoma, can rarely say that I have or had cancer. The truth is, I don't know. It could be floating around in my bloodstream or traveling through my lymph nodes. Advanced cancer patients like me live for the next set of scans, which for me right now are every 3 months. On those days, I sit in Dr. Jennifer Atlas's office and wait for her to come bouncing in the room to announce my scans look great. Woohoo! A cloud lifts for another 3 months, but one time last year, that did not happen for me. Before I jump right into my melanoma story, I want to tell you a little bit about me. I was born and raised in Statesville, North Carolina, which is in Iredell County, north of Charlotte. My husband Chad and I have been married for 38 years next week. And I turned 60 10 days ago. I have 2 children, Spencer and Caitlin. Both are married. Spencer to Kelsey and Caitlin to Braden. I have 4 grandsons. Ford is 5, Nat is 3.5, Drayson is 2.5, and Towns is 6 months old. I have one sister, Karen, and her husband, Rob. Both our parents are deceased. I have my in-laws, Stuart and Pat Percy, aka Nanny and Grumpy. My story begins with me growing up a product of the 60s and the 70s, which equals no knowledge of sunscreen or use of it. It wasn't a word I knew of that I can remember. I have fond memories of laying out in the backyard with my sister and our friends, knowing we would burn our skin, but if we were lucky, we would be gifted the golden tan. If you were lucky enough, or so I thought. Boy, was I wrong. Excuse me. So let's flash forward to the 80s. Marriage and children come along, as well as my earliest memories of sunscreen. I always remember putting it on my children and starting to put it on myself at that time. I have had several basal cells cancers removed in the last 10 years, 2 in my hairline, one resulting in Mohs surgery due to the location, and 1 on my back. So now let's move quickly to 2020. We all remember what was happening then. We were well into COVID at that point. To the best of my memory, Sometime around September or October of that year, I started to notice a hard knot appear in a long existing mole in my hairline. During that time, we were awaiting our third grandson and welcomed him into the world. So life was busy, joyful, and very fulfilling. Well, September and October turned into November and December, with Christmas and Thanksgiving and Christmas quickly approaching. I had showed the knot to Chad, my husband, and told him I was going to get it looked at after Christmas, after everything settled down. He said, "I don't think you should wait." He's right. So I thought of it, and I called my dermatologist, Dr. Elizabeth Ralston's office, to schedule an appointment. It was set for December 22nd, but the appointment was canceled due to an office closure for COVID exposure. My appointment was rescheduled for January the 13th, 2021, and a biopsy was completed that day. I remember thinking about Steve Udelson, the weatherman at WSOC. He had had a squamous cell cancer removed from his ear after a few experiences with basal cell. And he did a PSA on the news about it. So I remember thinking, I think this is probably squamous cell. I was not prepared for the phone call I received from Dr. Ralston on January the 18th at around 6 p.m. We had just gotten to my son's house to celebrate his wife's birthday when my phone rang. I looked down at the phone and was surprised to see Dr. Ralston's name come up. Mind you, it was after business hours, so this was my first feeling of alarm. I walked outside to take the call. I still hear the conversation and feel the terror inside of me. Dr. Ralston said, "Kathy, I'm so sorry to have to tell you this. Your biopsy came back to reveal a 4.1 millimeter advanced melanoma, the deadliest form of skin cancer." She cried along with me. She asked me if I knew what immunotherapy was. I said no. She attempted to explain as I attempted to listen. She said, "I'm referring you to the best doctor for your condition. His name is Dr. Richard White. He's Chief of Surgical Oncology at Levine Cancer Institute and Department of Surgery and Professor of Surgery at Atrium Health." Dr. White was my first point of contact at LCI on January the 26th. I went alone because of COVID restrictions. My family remained in the car on FaceTime with me. Dr. White was kind and compassionate, yet firm about the seriousness of this disease. I will never forget, he looked me straight in the eyes and he said, "The sun is trying to kill you, but we're going to do everything we can to help you live." He wrote down the only websites he allowed me to play Dr. Google on. Prior to my first appointment with Dr. White, I had also met with an oncology surgeon and plastic surgeon at Wake Forest in Winston-Salem. But on January the 26th, I walked out of my appointment with Dr. White, met my family at the car, and told them Dr. White would be performing my surgery on February the 12th. 2 days later, I would meet, again alone, Dr. Edward Tang, a plastic surgeon. As it turns out, I would need a skin graft to my forehead due to the large size of the melanoma tumor. He determined that skin would be taken from my lower tummy to graft over my wound site. Dr. Tang and I enjoyed lively conversations about the fact that if he was going to take skin from my tummy, I expected him to take all the excess skin. I told him I wanted to be able to bounce a quarter off my stomach. In one of our follow-up appointments, he actually came in with a quarter. The next 2 weeks were fast and furious with scans, labs, and more doctor's appointment in preparation for my first surgery, which would include wide local excision of 6 centimeters round to remove the cancer, a skin graft to cover the hole left behind, and a sentinel lymph node biopsy in my neck to check for metastasis. I left the hospital with 3 wound sites that day, one in my head, one in my neck, and one in my tummy. 1 week later, I returned to Dr. White for a follow-up visit and a review of the pathology reports, which showed, unfortunately, 1 lymph node with metastasis. So my pathological staging is determined to be 3C. Dr. White referred me to my next new doctor, Dr. Jennifer Atlas, who is my medical oncologist. On February the 25th, again alone, I waited to meet my new doctor. The door opens, and this precious young lady with long dark hair sporting a ponytail walks in. I adore this young lady. She is a true advocate for her patients. She is patient and kind and never rushes me or makes me feel like my questions are silly, and sometimes they are. When on occasion she does rush out of the room, it's only to find one of her colleagues that she wants me to see right away. In her words, I'm very impatient. This is something you want from your oncologist. It is truly an amazing thing to watch the doctors at LCI network in live time on your behalf. It gives me a sense of comfort I didn't know was possible as a cancer patient. Dr. Atlas has called me after hours on a Friday to give me results so I wouldn't have to wait over the weekend. And she loves to talk research with you. My sister commented after a recent appointment she attended with me how excited Dr. Atlas is about talking research and all the new clinical trials and findings within the melanoma world. Okay, so enough about her. Let's get back to me. During my first appointment with her, she explained my course of treatment would be 1 year of immunotherapy with a drug that I call Optivo Nivo, Dr. Aman, Nivo, Nivolumab. Did you hear what? She went over the many side effects. I think my first appointment with her was an hour and a half long. It was a tremendous amount of information, but I had a gut feeling I was in the best hands I could be in. So on March the 11th, I had my first infusion of immunotherapy at LCI Infusion Lab. Before COVID, all patients had a companion with them, but not anymore. Your extra chair sat alone as you watched these drugs drip into your veins and pray they worked. I had inflammatory side effects and colitis throughout that year with temporary holds and lots of prednisone to control these side effects. But finally, in April of 2022, I had completed my 1 year of immunotherapy. There were lots of emotions that went along with this. I was very happy to be finished with my treatment, but at the same time, I felt like my parachute had been taken away. I wasn't actually taking drugs to fight cancer anymore. But like we all try to do with hard things, you move through them the best you can. I enjoyed a nice summer and spring, or a nice spring and a family beach trip with 3 toddlers, so there weren't many dull moments. But sometime in July, I noticed a knot on my TMJ joint when I would open and close my mouth. As a cancer patient, every new pain, bump, lump, and discoloration leads you always back to the same question: is this cancer again? Well, the lump grew, and at the same time, another spot at my temple area started to swell up. Shortly thereafter, I had an appointment with Dr. Atlas, who examined them, left the room, came back into the room with a colleague on her cell phone, and proceeded to send me straight to Dr. Catherine Trinkel's office, where I would have a needle biopsy performed under ultrasound right away. Dr. Frinkel would be my 4th new LCI doctor, as she is a head and neck oncology surgeon. I left LCI that very day with the knowledge that the cancer had returned and surgery would be in my very near future again. In fact, Dr. Frinkel put me on her surgical schedule that day. But within a few days, Dr. Atlas called me personally to let me know she had moved my surgery up 2 weeks, and it would be on August the 4th. It would be a parotidectomy along with removal of the lesion at my temple. As suspected, both areas came back as metastatic melanoma. So now my staging is 3C malignant melanoma with recurrent and transient metastatic disease. And I had Dr. Atlas write that down for me yesterday. It's a mouthful. Radiation would be required this time. There were cancer cells still abutting the surgical margins. After a time of healing, I met with my 5th new LCI doctor, Dr. Stuart Burry, a radiation oncologist. I started radiation 5 days a week for 4 weeks. This is the mask that I wore during every session, radiation session, and it was clipped to the table so I couldn't move my face. And it's clipped so tight that when I would close my eyelids, my eyelashes would brush across the mask. So you wore it clipped down to the table like this, so you couldn't move. After my 2nd surgery, I also underwent genetic testing that would reveal my melanoma mutation to be BRAF positive. While this mutation can cause the melanoma to grow more aggressively, it at the same time opened up another avenue of treatment for me. There are targeted therapy drugs that specifically attack the BRAF mutation. This is what I'm currently on. They are pills I take 2 times a day, 12 hours apart on an empty stomach. When I started this treatment, I developed high fevers and chills at the same time every day, so Dr. Atlas put me on a 25% dose reduction. And I've managed well since then. My sweet husband brings my nighttime dose to me in bed every night in the lid of the pill bottle, because he can't touch them. They're too dangerous for someone that doesn't need them. So this is where I am in my melanoma journey. The plan is for me to complete these drugs in October. I've got it. Dr. Ralston provided me so kindly with a couple blow-ups showing a picture of them all before and after, and I hope you can see, and if you can't, certainly please come up if you want to and view them closer. This is just the mole I had forever, as long as I can remember, in my hairline. And then, it's like I said, I can remember it took about 2 months for it to grow into this. I think you can clearly see that it, I'm sorry?
That's your normal look.
Sorry.
versa.
That's first.
I directed him.
No, that was my fault, I put them in the wrong.
Dr. Ross can clear this up. So this is that's what it grew to very quickly. I need to thank my family, who are all here tonight, for their unwavering love and care for me. I also have many friends from our little city of Statesville here. They have loved on my family for 2.5 years, on my family and myself for 2.5 years. Although I'm standing here as a cancer patient, I have to say I'm one lucky girl to have all of you in my life. Thank you, David and Donna. See you hiding back there, Donna. For all the hard work you do to honor your daughter Jessica in such an important way by continuing to be a part of this community that one day puts an end to melanoma. I would like to end with a quick little poem that has meant a lot to me over the last couple years. What cancer cannot do. Cancer is so limited. It cannot cripple love. It cannot shatter hope. It cannot corrode faith. It cannot eat away peace. It cannot destroy confidence. It cannot kill friendship. It cannot shut out memories. It cannot silence courage. It cannot invade the soul. It cannot reduce eternal life. It cannot quench the spirit. And this is by Robert L. Lynn. Thank you very much.
Thank you for being with us, Kathy.
Thank you.
You know, in conversation with Kathy, when I got to